Therapy treatment that uses eye movement to help combat post-traumatic stress disorder. I went to Scottsdale Recovery Center to learn more about it. Post-traumatic stress disorder can happen to anyone. 70% of adults have experienced some type of traumatic event in their life. Of those adults, 1 in 5 of them will develop PTSD, according to PTSD United. Lisa Moody, clinical director at Scottsdale Recovery Center, says that many people try to deal with their PTSD by negative coping.
And a lot of times we don't have that coping mechanism set up, so we start doing things that potentially could be destructive, like isolating ourselves, not seeking help, not talking to anybody. And self-medicating.
However, there are better ways to treat PTSD. One of those ways is through eye movement desensitization and reprocessing.
EMDR uses eye movement in an awake state. So we use bilateral stimulation, which I'll show you with the machine, where the eyes are moving. So we simulate eye movement while people are awake.
Throughout the session, the patient hears beeping, much like a hearing test, and also feels vibrations through these devices called tactiles. The treatment allows the patient to see their traumatic event in a less disturbing way. After finding out her significant other passed away by suicide and losing contact with her family, Tracy Temple St. John knew she had to seek help.
After the traumatic incident, it got worse and progressively worse, and then where I hit rock bottom.
At the end of each session, the patient rates how disturbing their traumatic event was on a scale of 1 to 10. The goal is to get that patient down from a 10 to a 1. Once they've decreased the disturbance rate, the patient can then start installing positive beliefs about themselves with EMDR. Temple St. John believes she'll be in the program for a year, with the hopes of getting back to her old self and connecting with her family again.
The happy-go-lucky, but your intellectual, be able to carry that conversation on again, and be able to spend time with my grandson.
After 2 sessions of EMDR, Temple St. John has started to have a new outlook.
I'm significant, I'm important enough to have invest in myself, and that's what this is doing, that this program is doing.
Anyone can use EMDR therapy, and treatment length can vary depending on the severity of the trauma. The U.S. Department of Veterans Affairs has also claimed this as an effective means for helping veterans with PTSD.